secret supplements that stop hair fall and thicken hair fast. It is a common observation that many women, particularly after reaching menopause, notice a significant and often accelerating thinning of their hair. This experience is not merely a figment of imagination, but a tangible sign that a woman's body may be experiencing internal shifts that are not always immediately apparent. Doctors across the United States are increasingly focusing on these changes in older women, recognizing that this type of hair loss is not solely a consequence of aging, but rather a potential indicator of critical nutrient deficiencies. Ignoring these signals can lead to a cascade of concerns, including increasingly visible scalp, a thinning hairline, and a gradual erosion of self-confidence. The question that arises is why some women maintain thick, healthy hair well into their 70s and 80s, while others face significant thinning. The answer, while not overly complex, hinges on understanding the intricate workings of the body as it ages. This discussion will delve into 4 key supplements that have demonstrated the ability to make a substantial difference in hair health, with the most potent recommendation saved for last. Before proceeding, it is highly recommended to engage with this content by liking the video, sharing your age and state of residence in the comments to foster a supportive community of American women navigating similar challenges, and subscribing to ensure you do not miss future insights designed to help you feel like your vibrant self again. Let us begin with supplement number 4, a topic that might come as a surprise due to its relative lack of widespread discussion, especially concerning women who have experienced menopause. This crucial nutrient is biotin, a member of the B vitamin family. While the name might be familiar, its direct impact on hair quality as one ages is often underestimated. Biotin plays a vital role in how the body metabolizes proteins, the very building blocks of hair. A deficiency in biotin can result in hair that becomes brittle, prone to breakage, and experiences a significant slowdown or cessation of growth. For women over the age of 60, this becomes even more critical because the body's ability to absorb nutrients diminishes with age. Digestive processes slow down, and stomach acid production decreases, meaning that even with a healthy diet, essential nutrients may not be adequately assimilated. This scenario is frequently observed by medical professionals in postmenopausal women and is a primary contributor to hair thinning that can feel sudden and inexplicable. Biotin's function extends to converting food into energy, which in turn fuels the scalp cells responsible for producing new hair. When these cells lack sufficient energy, hair growth falters. Noticing a thinning crown or a slower regrowth rate after a haircut can be a telltale sign of biotin deficiency. Fortunately, the solution is straightforward and safe. Biotin supplements are readily available at pharmacies and grocery stores across the United States. For women over 60, a daily intake of 2,500 to 5,000 micrograms is typically recommended. As it is water-soluble, the body naturally excretes any excess, making it a generally safe option. While results are not instantaneous, many women report a noticeable increase in hair strength and a reduction in breakage after a few weeks of consistent supplementation, a small yet impactful step towards healthier looking and feeling hair. However, biotin, while beneficial, represents only a part of the solution. The subsequent supplement we will examine addresses a deeper issue, one that many women may not realize is impacting their hair until the effects are already substantial. Supplement number 3 is iron, and this is where the conversation shifts to a more serious concern. Iron deficiency is a leading cause of hair loss in women over 60, and it is a condition U.S. doctors routinely screen for when patients present with complaints of thinning hair. The significance of iron lies in its role in transporting oxygen throughout the bloodstream to all bodily tissues, including the scalp. Without adequate oxygen, the cells responsible for hair growth cannot function optimally, leading to a weakening, slowing, and eventual cessation of new hair production. For women post-menopause, iron levels can decline for several reasons. The body's ability to absorb iron decreases, and dietary intake of iron-rich foods, such as red meat, may also be reduced. Furthermore, even minor, undetected internal bleeding can silently deplete iron stores over time. The symptoms of iron deficiency are not always immediately obvious. One might experience increased fatigue or become winded more easily during daily activities. Yet, a prominent and often concerning sign is hair loss. An increase in hair shedding during brushing or washing, or the accumulation of more strands on pillows and in shower drains can be indicative of low iron. Hair may also feel thinner and more fragile, lacking its former body and resilience. This occurs because the body prioritizes oxygen delivery to vital organs such as the heart, brain, and lungs, classifying hair as non-essential. Consequently, in an iron-depleted state, hair production is curtailed to conserve resources for survival. The recommended approach is to consult a doctor for iron level testing. It is crucial to avoid self-prescribing high doses of iron, as excessive intake can be detrimental. A simple blood test will determine if a deficiency exists, and if so, a doctor may prescribe an iron supplement. For women over 60, a daily dosage typically ranges from 18 to 27 ml, adjusted based on individual results. To enhance absorption, it is advisable to take iron supplements with vitamin C, such as a glass of orange juice. While it may take several months for hair to show improvement, restoring iron levels often leads to a significant reduction in hair shedding and a noticeable increase in hair thickness. Even with optimal iron levels, there remains another nutrient frequently found to be deficient in women over 60, impacting not only hair, but also energy levels, mood, and overall well-being. This overlooked deficiency is more prevalent than many realize and is the subject of supplement number 2, vitamin D. The body naturally synthesizes vitamin D when the skin is exposed to sunlight. However, as individuals age, the skin's efficiency in producing this vitamin declines. Moreover, many women, especially after retirement, spend more time indoors or reside in regions with prolonged winters and limited sunshine. Consequently, even with regular outdoor activity, a vitamin D deficiency can develop unnoticed. U.S. physicians frequently encounter this in women over Medicare age and often recommend routine vitamin D level testing. Vitamin D's crucial role in hair health stems from its ability to foster the creation of new hair follicles, the microscopic pouches within the scalp from which each hair strand emerges. Insufficient vitamin D hinders the formation of new follicles, causing existing ones to shrink and become less active, resulting in reduced hair growth and thinner, sparser hair. This may manifest as a widening hair part or increased visibility of the scalp and a general lack of hair volume despite using familiar products and styling techniques. Beyond hair, low vitamin D can contribute to feelings of fatigue, sluggishness, and increased susceptibility to low mood or anxiety. It also affects bone health, making them weaker and more prone to fractures. Therefore, when hair thinning is accompanied by these other symptoms, vitamin D deficiency warrants serious consideration. The recommended course of action involves a blood test to ascertain vitamin D levels. If a deficiency is detected, a doctor will typically advise a supplement. For women over 60, a daily dosage of 1,000 to 2,000 international units is common, though some may require higher amounts depending on the severity of the deficiency. As vitamin D is fat-soluble, it is best absorbed when taken with a meal containing some fat, such as eggs or avocado. Improvements in mood and energy can often be observed within a few weeks, and over the subsequent months, hair may appear fuller and healthier as follicles become revitalized. While vitamin D is undoubtedly powerful, there remains one final supplement that holds even greater significance for women over 60 experiencing hair loss. This particular nutrient is often overlooked even by medical professionals, yet its influence extends to numerous aspects of health, making its understanding key to a holistic approach. This is supplement number 1, omega-3 omega-3 fatty acids, the supplement that truly brings everything together. Omega-3s are essential fats that the body cannot produce on its own, necessitating their acquisition through diet or supplements. They are abundant in fatty fish such as salmon, mackerel, and sardines. However, a substantial number of women over 60 in the United States do not consume enough of these fish to meet their omega-3 requirements. Omega-3 fatty acids are paramount for hair health due to their potent anti-inflammatory properties. Inflammation is a primary culprit behind the shrinking of hair follicles and the subsequent cessation of hair production as we age. Post-menopause, inflammation tends to escalate, a consequence of hormonal shifts that create a more reactive and imbalanced internal environment. This inflammation does not confine itself to hair. It affects joints, the heart, the brain, and overall energy levels. In relation to hair, inflammation damages follicles and disrupts the natural hair growth cycle, leading to a prolonged resting phase and increased shedding compared to growth. Omega-3s effectively mitigate this inflammation, restoring balance. They also enhance circulation to the scalp, thereby improving the delivery of oxygen and nutrients to hair-growing cells. Furthermore, omega-3s support the production of natural oils essential for maintaining a healthy, hydrated scalp. A dry, flaky scalp is a clear indication that follicles are not receiving adequate support, contributing to weak, brittle hair prone to falling out. U.S. doctors frequently recommend omega-3 supplements to women over 60, not solely for hair health, but also for cardiovascular and cognitive benefits, and to mitigate the risk of chronic conditions that become more prevalent with age. A typical daily dosage involves 1,000 to 2,000 milliliters of combined EPA and DHA, the two primary types of omega-3s. These are commonly found in fish oil capsules, and for those preferring a plant-based option, algae-based supplements offer comparable benefits. The recommended course of action is to commence taking a high-quality omega-3 supplement and to exercise patience. It can take 2 to 3 months to observe noticeable changes in hair quality, but when these changes occur, they are often remarkable. Hair typically becomes softer, thicker, and more resilient. A reduction in shedding and an increase in hair volume are commonly reported. Beyond hair, individuals often experience improvements in overall well-being, including reduced joint pain, enhanced mood, and better sleep quality. Omega-3 fatty acids stand out as a rare category of supplements that contribute to the health of the entire body, not just a single aspect. This comprehensive benefit is precisely why it is considered the most important on this list. It is imperative to understand that these 4 supplements function most effectively when utilized in synergy rather than in isolation. Biotin aids the body in processing the fundamental components of hair. Iron ensures that oxygen is efficiently delivered to the scalp, enabling those components to be utilized. Vitamin D is instrumental in creating new hair follicles, providing the pathways for hair growth. Finally, omega-3 fatty acids reduce inflammation and improve circulation, ensuring that all these processes operate optimally. Relying on only 1 or 2 of these supplements will likely yield incomplete results. However, by supporting the body with all 4, you significantly enhance the potential for hair to grow back thicker, stronger, and healthier. This is not a promise of overnight reversal of years of change, but rather a strategy to halt the decline and cultivate the conditions necessary for rebuilding. The sooner one begins this regimen, the more pronounced the positive outcomes are likely to be. It is also important to address a pervasive misconception among many women over 60, the belief that hair loss is an inevitable consequence of aging, something to be passively accepted with no recourse. This notion is inaccurate. While hair does naturally change with age, perhaps losing some of its former thickness, the kind of thinning that causes self-consciousness, avoidance of mirrors, or reduced social confidence is not an unalterable fate. Such thinning is a signal from the body that it requires support. By listening to these signals and responding appropriately, significant improvements can be achieved. Numerous women who have incorporated these supplements have expressed astonishment at the transformation in their hair's appearance within a few months, having previously believed they were beyond help. the body retains the remarkable capacity to grow healthy hair at any age, including in one's 60s, 70s, and even 80s. It simply needs the right nutritional support. Furthermore, supplements are most effective when complemented by other healthy lifestyle choices. Ensuring adequate daily water intake is vital, as dehydration negatively impacts the scalp and hair brittleness. A balanced diet rich in protein is also essential, given that hair is primarily composed of protein and the body requires a consistent supply for new strand formation. Stress management is another crucial factor. Chronic stress elevates cortisol levels, which are linked to hair loss. Additionally, treating hair gently is important. Avoiding tight hairstyles that can pull on the scalp, using a wide-tooth comb instead of a brush, and moderating hair washing frequency to preserve natural protective oils are all beneficial practices. Collectively, these habits create an environment conducive to hair thriving. For those contemplating where to begin, the most prudent initial step is to consult with a healthcare professional. Undergoing a comprehensive blood panel to assess levels of biotin, iron, vitamin D, and omega-3 fatty acids will provide a clear understanding of individual needs, preventing the expenditure of time and money on ineffective supplements. Armed with these results, a personalized plan can be developed. Your doctor can also guide you on appropriate dosages and ensure there are no adverse interactions with existing medications, a particularly important consideration for women over 60 who may be managing multiple prescriptions that could influence nutrient absorption or supplement efficacy. A frequently raised concern in community discussions is whether it is too late to initiate these measures if significant hair loss has already occurred. The answer is a resounding no. It is never too late. Even if hair thinning has been ongoing for years, the hair follicles, though potentially dormant or weakened, are still present and capable of regeneration. With the right nutritional support, many of these follicles can resume hair production. This process requires time and patience. Immediate, dramatic regrowth is unlikely, and returning to the exact thickness of younger years may not be fully attainable. However, substantial improvement is achievable, leading to increased confidence and a reduction in daily anxiety about one's hair. This pursuit is undoubtedly worthwhile and entirely within reach. Therefore, the key takeaway from this discussion is that hair loss experienced after menopause is more than a superficial concern. It is a signal that the body is lacking essential components. Addressing these deficiencies can elicit a surprising and positive response in hair health. Biotin supports the structural integrity of hair, iron ensures adequate oxygen supply to the scalp, vitamin D promotes the development of new follicles, and omega-3 fatty acids combat inflammation and enhance circulation. When these four supplements are taken together, they equip the body with the necessary tools to foster healthier, thicker hair, even past the age of 60. However, consistency, patience, and a long-term commitment to one's health are paramount, as this is not a quick fix solution. Adhering to this approach will yield results, and more importantly, will contribute to a renewed sense of self, confidence, and attractiveness, allowing you to feel like the woman you have always been, irrespective of your current hair situation. Ultimately, this is about more than just hair. It is about safeguarding one's sense of self, personal independence, and overall quality of life after 60, and these are aspirations well worth pursuing.